Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, and welcome to our Tuesday, June 22nd press briefing. We are now in week 16 of the COVID pandemic here in Montgomery County, and our third week and final week in the yellow phase. So since our June 18th press briefing, I have a 4-day cumulative total of 124 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 8,041. These positive cases are a result of a positive test for the virus, not the antibody test. On Friday, we had 48 cases, Saturday, 26, Sunday, 31, and today, 19. In total, over the 4 days, 27 of those cases were from long-term care facilities, and 97 were from the community. These positive individuals are from 35 municipalities. 61 of 62 Montgomery County municipalities are home to individuals with COVID-19. These individuals range in age from 2 years old to 104 years old, and you can check our county municipal map at montcopa.org/COVID-19 for updated geographic information. Today we have 67 females and 57 males. I'm saddened to confirm that one more Montgomery County resident has lost their life to COVID-19, which brings us to 781 deaths confirmed positive from COVID-19. This individual passed away in a hospital. 70. In total, since the pandemic began, 411 females and 370 males have lost their lives to COVID-19. In terms of the racial breakdown for those individuals for whom we have it, we have 18 Asian, 3 Asian Indian, 3 Asian Korean, 95 African American or Black, 294 white, and 368 unknown. In terms of probable deaths, we have 88 probable deaths. And remember, these are deaths that COVID-19 is the cause of death on the death certificate, but we do not have laboratory confirmation of that. So 88 of those added to our 781 confirmed positives gives us a total of 869 deaths from COVID-19. And as always, if any of those probable deaths do get laboratory confirmation, then we add them to the confirmed positive number. At this point, we have 653 confirmed positive deaths of individuals associated with a long-term care facility, and that is 84% of our 781 total confirmed positive deaths. Our hospital bed situation continues to move in the right direction. Today, we are down to 85 individuals hospitalized in a Montgomery County hospital with COVID-19. This is the lowest number that we have seen to date since the pandemic began. So this is great news. 24 of those individuals do require a ventilator, which is about 29% of those individuals. This is actually the highest percentage of people who have needed a ventilator. And I think what this is telling us is that those that do remain in the hospital in many cases are quite ill, and we hope for their speedy recovery. There's no update from our correctional facility today. Everyone there, it remains stable, and no new cases to report. Our community testing sites are all up and running today. Our Pottstown site is open from 11 to 1, Monday through Friday, weather permitting. And that site is located at our Office of Public Health, Pottstown Health Center at 364 King Street in Pottstown. To make an appointment for the Pottstown testing site, you can call 610-970-2937, starting at 8:30 in the morning of the day that you'd like to be tested. And again, that's Monday through Friday. Our Norristown walk-up site is also open Monday through Friday, 11 to 1 for testing at the Delaware Valley Community Health Center. To make an appointment for Norristown, you can call 610-592-0680, beginning at 8:30 in the morning of the day that you would like to be tested. And in both Norristown and Pottstown, there are Spanish-speaking operators available. And our Montgomery County Community College drive-through site is also up and running this week. For the dates that include April the 16th to June the 15th, we have tested 10,095 individuals at this site, and we have received results on 9,909 of those individuals, which represents 98% of the total. 1,301 of these individuals are positive or have tested positive. So for that 49 days of testing, we're running 13% positive overall. And in the last 14 days, we're running a positivity rate of 11%. And remember, that's just from that particular testing site, including Norristown and Pottstown. To make an appointment at the drive-through site, you can start for tomorrow by calling at 8 a.m., 610-631-3000, or going online at moncopa.org/COVID-19, also at 8 a.m. tomorrow for appointments Tuesday. Just want to encourage everyone to get tested, and a reminder that all of our testing sites are open to anyone who needs or just wants to be tested. And if you have any concerns or any symptoms, or maybe you're going to visit an elderly relative and want to get tested before you go, we welcome you at our sites. It's very important that people continue to get tested so that we can make sure that we have a clear picture of how much virus is circulating here in our community. As a reminder, there are additional testing sites. Both CVS and Rite Aid are offering no-cost testing at several locations in Montgomery County to individuals who are 18 years of age or older. And an updated list of these locations at moncopa.org/COVID-19 under the County Testing Information button by clicking on the testing sites map. So an update on our parks. As you know, we've been doing a phased reopening of our county parks during the yellow phase, and it's been going well. So far, we have opened Norristown Farm Park, Lock 60, Green Lane Park for both fishing and boating, Upper Schuylkill Valley Park, and Central Perkiomen Valley Park. And today we are opening our last two parks, Lorimer Park and Lower Perkiomen Valley Park. So as of today, all of our county parks are now open. You can go to moncopa.org/parks for additional details about which facilities are open at each park. I want to emphasize that park users must comply with all physical distancing markers at each park, and that while you don't have to have a mask or face covering on while you're enjoying the park with just your household contacts, we are asking you to have a mask or face covering with you so that you can quickly cover your nose and mouth if you find that you are near others, people that are not part of your household contacts. Taking these very important steps will allow us to keep our parks open and safe for anyone who would like to use them. As you know, the county has been facilitating a delivery of free food each week for the past several weeks, and the final food delivery will be this Thursday, June the 25th. This is a no-cost food distribution opportunity. There was originally going to be an event on July 2nd as well, but this has been canceled. This week's distribution will take place at the Greater Philadelphia Expo Center, 100 Station Avenue in Oaks, from 11 a.m. to 1 p.m. or as long as supplies last. The distribution is being coordinated by the Modco Anti-Hunger Network in conjunction with Feeding Pennsylvania and Philabundance. I want to thank Upper Providence Township, the Greater Philadelphia Expo Center for hosting this, the Montgomery County Department of Public Safety for logistics coordination, and several other county departments that are assisting, and the volunteer agencies that are assisting in the distribution. They include RSVP, Montgomery County Medical Reserve Corps, and the Montgomery County Animal Response Team. The food this Thursday is being provided at no cost through the USDA Coronavirus Food Assistance Program and will consist of 2 boxes of food for each vehicle. This program is designed to support both our Pennsylvania farmers and our Montgomery County residents who are in need. 3,000 boxes of food are available for distribution on Thursday. This week, there are 1,500 boxes of mixed dairy and 1,500 boxes of mixed fruit. Any food not distributed will be dispersed to local food banks in Montgomery County. This week, we will also have a limited supply of dog and cat food, also at no cost. This is a no-contact food distribution. All participants will be asked to stay in their vehicles with windows rolled up and follow prompts from the volunteers. Anyone in need is welcome. You do not have to live in Montgomery County to participate, and no identification or paperwork is required. More information about this event will be on the Modco Anti-Hunger Network website, which is www.modcoantihunger.org. That's modcoantihunger.org. So as a reminder, we entered the yellow phase on June the 5th, and we will move to green on June the 26th. And our goal, as always, is a responsible reopen. So we've put up a graphic to go over what it means to be in green. In terms of work and congregate settings, if you can continue to work from home, that is strongly encouraged. Businesses with in-person operations must follow the updated business and building safety requirements. All businesses that have been operating at 50% occupancy in the yellow phase may increase to 75% occupancy. Child care may open if it's not already open, complying with guidance. Congregate care restrictions are still in place. And so if you have a loved one in a long-term care facility, you should check with them and see if they are offering any opportunity for visits, but that is still pretty restricted. However, both correctional facility and hospital restrictions have been loosened, and in many cases, those visits are now possible. Schools continue to be subject to the Center for Disease Control and Commonwealth guidance. In terms of social gatherings, you can now gather with up to 250 people, so no more than that is prohibited. Restaurants and bars are open at 50% of occupancy. Personal care services like hair salons and barbershops can open at 50% occupancy and by appointment only. Indoor recreation, health and wellness facilities, and other personal care services like spas, gyms can be open at 50% occupancy with appointments strongly encouraged. And all entertainment such as casinos, theaters, shopping malls, zoos, they can be open at 50% occupancy, and construction activity may return to full capacity as long as they're following protocols. So a lot more options out there, which is great news, and really great news for so many of our local businesses. But as always, I have to sound my cautionary notes. So we've now seen a number of states that reopened 4 to 6 weeks ago, and a number of them are experiencing their highest number of daily new cases since the pandemic began. So COVID-19 is not over. Green does not mean going back to the old normal. Green means going forward to a new normal, one where we are living as safely as possible with this virus. The risk is not going to be zero, but there are straightforward steps that we can each take to reduce the risk to ourselves and our families, and to reduce the risk to our community as a whole. We have been in this together from the beginning, and we continue to be in this together. Our success in keeping this virus at a low state in our county is by working together and moving together in the same direction. So what does that mean? As I mentioned earlier, don't hesitate to get tested. Anyone who wants or needs to be tested is welcome at any of our testing sites. If you do test positive, please cooperate with contact tracing. This is one of the tools that we will be using going forward to make sure that we can help contain any disease outbreaks. And then as you think about how to live with this virus and which activities you should participate in, consider a couple of things. One is, how risky would it be for you if you contracted COVID-19? People who are over 70 are at the highest risk. People between 50 and 70 years of age are in a moderate risk. However, if you have any underlying medical conditions that compromise your immune system, compromise your lung function, or if you have diabetes, these are all things that put you at much higher risk regardless of your age. Think about what type of activity you would be doing. Outside is always better than inside. And activities that involve loud speaking or intense physical activity, like a group exercise class or singing, are much higher risk. Also consider the duration of the exposure for the activity. Living with someone is obviously going to be relatively high risk, someone who's positive with COVID, but attending an indoor event that is an hour or two long is certainly going to be riskier than doing a similar type of event outdoors, and also much riskier than just passing somebody on the street or passing somebody in the grocery store aisle very briefly. So it's all about duration of exposure. And then the distance. So does the activity involve something where you can stay physically distant from the other people participating in the activity? Can you stay 6 feet apart if you'd like? And will everyone be wearing a mask? I can't emphasize how almost now weekly we get more and more data from really good, solid studies that show that when everyone has a mask on, even a cloth mask, it does reduce transmission. Doesn't reduce it to zero, but each of these things that I just talked about together help reduce the risk. So please think about those things when you're heading out or deciding whether or not to partake in a particular activity. And if we all just thoughtful and use some common sense and are personally responsible and careful in how we conduct ourselves out in public, I hope very much that we'll be able to get through this safely and not have to move backwards and keep going forward. And hopefully sooner rather than later, we'll have a vaccine. So with that, I will turn over to Commissioner Lawrence.
Good afternoon. This afternoon, I'm going to provide an update on the Montgomery PA COVID-19 Response Fund, which was established on March 26th and is being administered by the Montgomery County Foundation. At the end of last week, over $750,000 had been raised or committed for the fund. This is up $150,000 from my last report in mid-May. I'd like to thank all the local foundations, businesses, and private citizens who have contributed. As of today, 127 local safety net organizations and first responders have been awarded $413,500, and the fund is reviewing more requests this week. This is a community-wide effort to support the immediate needs of agencies serving the needs of residents hardest hit by the pandemic. Grants of up to $5,000 are being reviewed and processed on a rolling basis to safety net organizations and first responders. Projects are prioritized based on the geography they serve, the capacity to meet the higher demand for services, and whether the project targets particularly vulnerable populations. Grantees so far include food pantries, senior care programs, rent and utility payment programs for low-income residents, behavioral health care and telehealth services, ambulance services, child care for healthcare workers, domestic violence services, protective personal equipment purchase for nonprofits that are continuing essential in-person services, and emergency shelters. So even as we head into the green phase, funds are still needed to support the ongoing efforts of our first responders and social safety net providers who are still helping those who continue to deal with the effects of COVID-19. So if you are able to help support the need and high demand for grant requests, you can make a tax-deductible donation and can find more information at www.montcopa.org/COVID-19. Safety net organizations and first responders can also apply for grants there, and there is a complete list of grantees available. That concludes my report. Thanks.
Thank you for that, and thank you to everybody who's donated. It's really phenomenal. So just some housekeeping announcements. We will continue to have a weekly or a daily press release tomorrow and Wednesday. We'll have an in-person briefing on Thursday at 3, and then a press release on Friday, which will be our first day in green. And then starting next week, we are not planning any in-person briefings, but will not hesitate to hold one should we have anything that changes or any substantial amount of information that we want to share with everyone. We will also be going to a weekly press release starting next Tuesday, the 30th. Now, 5 days a week, Monday through Friday, we will be updating our county hub data site, the montcopa.org/COVID-19. That will continue to be updated every day, Monday through Friday. And hopefully nothing major will come up and we can continue to update through our briefings and the website and through our regular public meetings, which happen twice a month. But certainly if there's anything that requires more than that or is of a timely nature, we will definitely convene an in-person briefing. And with that, I will turn over to any questions.
We have no questions today.
Okay, well, that makes it easy. All right, so then we will see you Thursday at 3 o'clock. And thank you, Sarah.